Again, Dr. Mary, if we could just start and say, how treatable is mental illness? Is it something one can recover from?
The answer, Melanie, thankfully, is yes. And one of the main messages I would like to convey to your viewers today on this online platform is that your mental wellness is equally as important as your physical wellness. And the good news about that is that for a number of mental health conditions, we have treatments that are both effective and available. And so I would encourage your viewers who are watching this online to take advantage of the opportunities that are available in Mississippi in their community to seek the mental health treatment that is available and take care of your mental wellness.
For the person that is struggling, I imagine that that primary doctor is going to be their first source. They need to talk to them.
That's very often an avenue of first availability of treatment or referral for many mental health conditions. Persons often come to their primary care doctor complaining of some physical ailment or not being able to sleep or a loss of appetite. And if the primary care provider drills down on that symptomatology a little bit, you can quickly see that many real presentations of visits to the primary care provider, there's some component of underlying mental health issues such as depression, anxiety, substance use. It's very common to see that in the primary care setting.
How well equipped is Mississippi to, with providers to provide good mental health care?
Well, there's good news and bad news about that, Melanie. The good news is that the providers that we have are dedicated, hardworking, committed workforce. We have good people in mental health. The problem is there's not enough of them. We could use many more psychiatrists, primary care providers who are savvy in treating mental health issues, nurse practitioners, psychologists, licensed professional counselors, LPCs. We just don't have enough of the workforce out there, especially in the rural areas up in the Delta and anywhere outside of a major metropolitan area in Mississippi. There's just not enough of those qualified and available mental health professionals. And the ones that are there are great, but we don't have enough of them.
We have, you know, we hear more about mental health issues in the news now because a lot of these people make the headlines when something tragic goes on, and you dig deep and you learn that they had this happen and this, and they suffered with this and this. A lot of times, even at younger ages. With that, we become more aware of this. Has that helped at all to kind of alleviate the stigma? We're talking more about it. We're learning. We hear names now that or diagnoses that we maybe had never heard before.
There is an ongoing problem with stigma that is a big barrier to treatment in mental health. The good news about that is that the effects of stigma seem to, at least in my personal experience, the effects of stigma seem to have lessened over the years with a number of things that have happened in our society, such as passage and enforcement of federal laws dealing with mental health issues, the rise of social media and people like celebrities and sports figures and people in politics who are in the media every day are using social media platforms to come out and say, I've been treated for bipolar disorder. I've been treated for depression or anxiety, and my treatment was a success. And so I think that to the extent that social media has pervaded our very existence these days, one of the, I think, beneficial effects of that is the increased public awareness of mental health and mental health issues and treatability of mental health issues. Now, the flip side of that is you get too much social media on board and you're actually causing more problems than you're helping, and that's a whole other area, topic of conversation. But I'm not here to be a big proponent of spend all your time on social media and learn about mental health. You've got to temper that with.
But you're right, because I remember when, if you can remember, U.S. Senator Thomas Eagleton.
Yes.
Do you remember when he had the shock treatments? Well, that was it.
I was a teenager when that happened, and I remember that. I was following national politics at the time, and remember the terrible treatment that he got in the press in the early 70s for his treatment of mental illness. We've come a long way from those days, a long way.
So that's certainly a positive. Tell us again briefly about the different people, the different providers available, and why they are different, and how they function.
Sure. So one of the nice things about that I like in working in mental health is that it's a multidisciplinary and collaborative field, and we work closely together as a team to diagnose and treat mental illness, and that team could consist of a psychiatrist who's a physician, has graduated from medical school, and would be able to provide prescriptions for psychiatric medication, and diagnose and treat mental illness from what's called the medical model, or in training as a physician. Other mental health professionals that are important members of the mental health treatment team include psychologists, and a psychologist is a person who's been to many years of graduate school, not medical school, but graduate school, and studied mental illness and done research in it and treated in supervised settings persons with mental illness. So when they graduate from a psychology training program, they're ready to do what we call the talk therapy piece, or the psychotherapy. And study after study has shown that the most effective treatment for many forms of mental illness is a combination of psychiatric medication and talk therapy. So psychiatrists, psychologists, there are also other forms of mental health professionals that are very important members of the treatment team, such as social workers, licensed professional counselors, nurse practitioners provide a large amount of the workforce in Mississippi, and prescribe medications and work in collaborative relationships with physicians. So those are some of the most important members of the mental health treatment team.
And I can imagine that in the rural areas, do we see telemedicine there at all?
Telehealth.
Psychiatry or telehealth?
Telehealth is becoming more and more of an established and accepted treatment modality in Mississippi. I'm very glad to say there are a number of telehealth programs that are reaching out to persons in rural areas and that have lack of access to qualified providers, and so telehealth is very much a treatment option for persons with mental illness in Mississippi.
That's very good. So where do we go from here? What would you hope for? More providers?
Certainly more providers, more qualified, well-trained, dedicated workforce to add to the qualified, well-trained, dedicated workforce that we have. We need more of us, number one. Number two is education of the public about the ill effects of stigma and the emphasis on mental wellness being equally as important as physical wellness. So there's now there's a workforce component, but there's also an education component that providers as well as the public need to know that mental illness is treatable and what their resources and assets are in their community or by telehealth or whatever treatment modality. We need more education to tell people that help is available and the help that is available is effective. That'd be the top two things on my wish list.
How about, we'll end it with insurance and how you pay for this. Has that become any easier for people? Depending on your... Well,
it depends on everyone's individual circumstances, what their health plan will pay for, whether they've got, some private insurer through their job, whether they're insured with the Medicaid program or CHIPS or whatever their provider is. That's another thing that deals with the education component is people have to be savvy consumers, not only in their physical health care, but also in their mental health care. They need to know how many outpatient visits their plan will provide for, what medications. There's something called a formulary that all insurance plans go by, in which the insurance company may pay for this medication and may not pay for that medication. That's the sort of thing that a savvy, educated consumer when they go in to meet with their mental health provider, they will know, they've educated themselves on the front end to say, you know, I've looked into my insurance plan, and I'm familiar with the formulary, and I know what they will cover. Yeah. So
it is
it pays in mental health just as much as physical health to be informed about what your treatment options are and what your particular provider will pay for.
That's good. Excellent.